Hi everyone, William here with the Grand Duke Dmitri Diary Series. We are in 1915 today and ready to learn a little something about medicine, medical practices in 1915. We've already found out that people were sometimes given arsenic and it made them sick. That was Dmitri's experience. So, our recap for the previous video, 1936 speech. We did the first couple of paragraphs of it, and there was a lot of talk about accusations from the right that young Russia that they were provocateurs, that they were engaged in some shady conspiracy, and reference to revolution. So pretty fascinating stuff, I thought. Our last 1915 entry, we had just Dmitri sort of partying on the eve of his surgery. He knew he was going to be out of, or under the weather, out of circulation for a while. Okay, our cast today, we have two important court doctors, Polyakov and Ostrogorsky. We have Maria, and we have an unnamed medic, a feldsher, which I gather is sort of, in the modern day, it's used to refer to a paramedic. So it's something in between a nurse and a medic, like a battlefield medic, or you get the picture. Okay, so we're up to the 8th / the 21st of February in Petrograd. Nevsky 41 is the address. It's 2 degrees and overcast, so the weather's getting a little nicer. It's a little warmer than it has been, but that is of no use really to Dmitri on this particular day. Okay, here we go. Dr. Polyakov and Dr. Ostrogorsky arrived around 11 o'clock. The living room was rearranged a little. They took out the furniture and the carpet and put down oilcloth. Polyakov brought his medic with him. They all put surgical gowns on. Maria helped. First they smeared my throat with cocaine, then Polyakov inserted the instrument. It felt like my head was being ripped to pieces. Blood flowed from my throat and nose, but only quite a small amount, relatively speaking. Maria held my head. It all ended fairly quickly, but my head hurt like crazy. It felt like it had been ripped to pieces. I had to lie in bed with ice on my head for the rest of the day. Toward evening, I felt a little better. Maria took care of me in an amazingly touching and kind way all day long. She hardly left my bedside. I got up for a minute in the evening and the pain started weakening. I didn't eat anything but jelly and cold water. I hope this will all be over soon, indeed. All right, so in a previous video I talked about how I was rather mystified by this operation. And it's not a mystery at all, isn't it? It's crystal clear. He had a tonsillectomy. I guess because in my own translation there had been some missing words, but Alexandra and Natasha in their transcript managed to get a lot of those words, and so like I said, it's no longer a mystery. He simply had a tonsillectomy. And why a tonsillectomy on a 23-year-old? Well, I mean, it's very apparent to me from just about any photograph you look at of Dmitri that he breathed through his mouth. He had some kind of nasal obstruction. So he was breathing through his mouth, and that continued to be the case long after the tonsillectomy. But that may have been the reason why they decided to do it. He may have had chronic tonsillitis. I don't know. He didn't, as a child, he had lots of headaches, but Yeah, he never mentioned really an inflamed throat. Or they could have just thought, well, he says that he's feeling weak and he doesn't know what's wrong with him, and so what the heck, let's try this. It's a pretty easy and safe procedure. So these doctors, Polyakov and Ostrogorsky, were attached to the imperial family. I remember Ostrogorsky's name coming up in a letter that Dmitri wrote in 1910 in relation to little Alexei. But anyway, they were both, I think, in their 40s or 50s, and they were given the assignment. So they show up with this feldsher, with this medic, and they probably call the servants in to roll up the carpets and move the furniture away and put a sort of operating table there in the living room. Maria, was she wearing her nurse's uniform, her Red Cross uniform? I don't know, probably. The rest of them are putting on their surgical gowns. So this is a type of tonsillectomy called a guillotine tonsillectomy. So I learned a lot from this. I learn a lot from Dmitri in general. I have over the years, because I'm always curious about these things, and I do my best to research them. And it was not difficult to find out the details. Dmitri refers to this instrument being put into his mouth, and after that it felt like his head was being ripped off. Now, the cocaine was obviously a local anesthetic. I have no idea how effective it is. They weren't giving him an injection of Novocaine or anything like that. It was just smearing his throat with the cocaine, and obviously it wasn't that effective because it was extremely painful. But why? So this guillotine tonsillectomy is with this instrument. You've seen a photo of it in the thumbnail photograph, and it does two things. It crushes the tissue, it crushes the tonsils, and then it cuts them. And I don't think it gets the whole tonsil, but most of it. And there are some benefits to it, apparently. One of the benefits is that, you don't have to have general anesthesia. And so that, there's always a certain amount of risk involved with general anesthesia. And another benefit, which Dmitri refers to, is, believe it or not, that you don't bleed as much if you have a guillotine tonsillectomy. It does it in apparently a really neat and efficient way and minimizes the amount of blood that's lost by quite a bit. So, yeah, I don't know if Dmitri had the option of having general anesthesia, which of course would have meant having a longer recovery time and more risk in relation to the blood loss and the anesthesia itself. But this was not the only method of removing tonsils in 1915, but this is what they ended up doing. Okay, and Maria, he's genuinely grateful to her. She took very good care of him. She was a good sister sitting by his bed, and she was a good nurse, and she was given this job of holding his head down. Good Lord, can you imagine having this operation yourself with just, a kind of mild local anesthesia and having... someone, what it feel with this big metal thing in down your throat and cutting. And boy, she must have had her work cut out for her holding his head steady. But, I think, I'm not sure, but I think she'd had some experience already by that time. Actually, yeah, because Dmitri had talked about, earlier in January, talked about with Ella, hadn't he? About how, maybe not, about how, about how neither of them was happy that she was really off doing her nurse thing. I think Dmitri considered it too dangerous, that she was too close to the front. Anyway, I'm sort of yammering today. What do we have next time? Well, when we return to 1915, Dmitri will be in bed, of course, but don't think it's going to be a boring diary entry because he's going to have a whole parade of visitors, some of them quite interesting. And next time in 1936, things are really getting personal in this speech that Dmitri is given at the Young Russia Party conference. So come back and hope you're enjoying it, and I'll see you next time.